Hi everyone, welcome in. I'm just letting folks in from the waiting room. Okay, I think we can go ahead and get started. Some folks may still trickle in, but it seems like we have a good amount of people on the call today. Um, Great. Okay. Yeah. So hi everyone and welcome back to our Thrive Rise COAD quarterly meeting for December. I hope everyone had a really good start to their holiday season. If you'll remember, our last quarterly meeting was in June, and so that's where I was introduced to the COAD. I started at Thrive in the beginning of June, and our quarterly meeting was at the end of June. So I was introduced. We also introduced the co-chairs for each committee and gave a preview of the work that they're doing, that they'd be doing in the upcoming months. And so since that time, the committees have been hard at work crafting their disaster readiness snapshots, and they're excited to share that with you all today. Another big event for Thrive since the first COAD meeting was the fourth annual climate summit for San Mateo County that we hosted at Stanford Redwood City campus in October. The theme was sustaining community power and climate resilience, and the sessions that were developed by our host organizations really gave participants a lot of food for thought and kind of illustrated the linkages between climate resiliency and communities at disaster preparedness within the county. We'll go ahead to our agenda. You can see it's pretty packed today, and we want to give a lot of time for each of the issue area committees to share their snapshots as well as have some time for Q&A before the end of the call. So I want to get started, but before we dive into things, I wanted to pass it over to Thrive's Chief Executive Officer, Georgia Farouk, to provide some opening comments on the past few months of the hard work done by our COAD committees, and then how that work will kind of carry into our ongoing relationship with the San Mateo County Department of Emergency Management. So I'll pass it over to Georgia.
Thank you, Betty. Betty, can you hear me okay?
Yep, I can hear
Yes.
you.
Okay, great. As Betty said, I wanted to add my thanks to you all, especially our co-chairs for our 4 issue area committees for the very hard work that has happened over the past several months. Betty, in particular, I want to thank you for facilitating these work groups and really helping shepherd them along. I think there's been a ton of progress made, and I'm really just thrilled at all the progress that has been made. We want to acknowledge Betty and I and the whole Thrive team want to acknowledge all the time, the thought, the community engagement that's gone into each of these disaster snapshots, and you're going to see them being presented soon. They come directly, again, from months of input from the community members, partner organizations, and they really, I think we're also excited because we are going to be able to provide a little bit of a introduction to the county's Department of Emergency Management tomorrow. So we're going to be joining tomorrow. We're going to be joining DEM for kind of I don't know if many of you were probably part of the meeting that we had a while back at the emergency management at EOC, where we brought together the COAD with the emergency management department as they were thinking about their own strategic plan. And Shruti, the head of DEM, was kicking off that strategic planning process, and she engaged all of you in that process. And one of the things that came out, and Shruti will be talking more about this tomorrow, is that that communications piece is really critical when a disaster strikes. And I think when we met recently, we recognize that with all of this good work, we still don't have a strong plan for communications if disaster strikes. So when that happens, we need to be ready and we need to have a strong communications plan. So they have the resources to do that. They have the resources at the county level. They've been investing more in that piece, that communications piece. And so we're really happy that they've come so far along and that they want to partner with the COAD on this. And so tomorrow they're going to be sort of helping, they're going to be introducing this cluster model and a communications framework that will work in synergistically with the COAD. And we're going to figure that all out together tomorrow. So it's an exciting moment to align our work and ensure that the systems being built at the county level reflect what you've surfaced from the community. I think the main thing is that the county has really heard the need loud and clear, and they're making the investments that are necessary. So that's really important to us. So I think we want to hear more from you. So I won't go off in any more generalities. I think I'm going to pass it back to Betty now. Again, thank you all for working with us. So many of you, so many of the COAD's leadership are going to be at that meeting tomorrow. And so we're really grateful to be in person together tomorrow. We're looking forward to it. I will pass it back to Betty.
Great. Thanks, Georgia. And thanks for that helpful context of our relationship with DEM as well. And I see a few DEM folks on the call. I see Sandra as well. So grateful for that partnership. Great. So I just wanted, I know this will be repetitive for a few folks, but I know we also have some new faces on the call and some new first-time kind of general members joining today. So I wanted to give as brief but as like informative as possible of just a refresher on the COAD and the work that we're doing. So the COAD, or Community Organizations Active in Disaster Response, is a collaborative network of public, private, and nonprofit organizations working together to prepare for, respond to, and recover from disasters. So Thrive Rise COAD supports the San Mateo County communities in all phases of disaster with the aim of really reducing harm, building community resilience, and minimizing the impact of future hazards. And as a liaison to the COAD, Thrive Alliance, and my position helps manage the structure of the COAD, so the communications, events, program planning, and new partnerships for Thrive Rise, so that the COAD members and co-chairs can really prioritize mitigation, preparation, response, and recovery to a disaster. So this slide is a bit dense, but I think it'll be able to give you an idea of how communications and resources kind of flow in the COAD. So you can see that there are four different phases of an emergency or disaster that the COAD can engage in. So the mitigation and planning is kind of the steady state operations. And so that's what the COAD will hopefully be existing in for the majority of the time. And so that includes those examples like coordinated engagement for long-term planning, working with community leaders, activism and support for disaster mitigation efforts, and identifying needs and capacity gaps. We can see when there's an event that will trigger a disaster and emergency, the COAD will either self-activate or will formally be requested to activate by San Mateo County Emergency Management. And so in that instance, COAD operations kind of shift into response work. And so that's where you kind of see that communication structure where the county is communicating information about conditions, available resources, evacuation and shelter information that flows to the Thrive Rise COAD liaison or myself. And then that information is kind of proliferated down to general COAD members, but then also through the four different issue area committees that we have. And you can kind of see branching off of that the resources and information that can flow down that chain of command. And then information can also flow upwards. So receiving real-time information from CBOs and community members on the ground can then be sent back up the chain to co-chairs, back up to the COAD liaison or myself, and then I can communicate that upwards to emergency management to help them kind of target their response efforts as well. And then towards the bottom, we'll see recovery efforts as well. So continued longer term coordination, recovery support, multilingual communication on recovery resources as well. So as I mentioned a bit, we have 4 issue area committees. These are the ones who have created the disaster readiness snapshots that they'll be presenting on today. Children and child care, older adults and access and functional needs, mental health and spiritual care, and food security. And we're kind of continuously recruiting for committee members for all committees. So if one of these sounds interesting or you see the snapshot that the committee did and you're interested in learning more or even working on efforts related to that committee, please get in contact with me after the call and I'll definitely be able to add you to one of those committees. But yeah, as the slide says, we support planning and risk reduction initiatives in the specific committee areas. They meet monthly and they kind of serve as a forum for organizations and concerned community members with expertise or interest in these areas. Yeah, like I said, we're kind of continuously welcoming new members to join us. This is the meeting schedule for each of the issue area committees. We try to keep them as consistent as possible. And I have the meeting dates for January for the new year listed here as well. Great. So now I'll pivot into the kind of the first main deliverable or first piece of work that each of the committees have been working on for the past few months, and it's called the Disaster Readiness Snapshot. So these snapshots are really a concise overview of sectors, gaps, risks, and priorities related to disasters. Each of the snapshots reflects several months of committee discussions, real-world experiences, and local knowledge gathered from nonprofits, public agencies, and community partners. There's a few main kind of important pieces of the DRS and the importance it serves more widely is just kind of providing a shared understanding of current disaster challenges and capabilities across the county, highlighting urgent needs for each kind of population group and sector's focus, identifying key partners, resources, and gaps, and kind of serving as a foundation for future planning, including emergency operations plans and committee work plans, and then overall just strengthening that coordination that exists between nonprofits, government agencies, and kind of networks of communities. And I think as Georgia mentioned a little bit earlier, we can see the connection of these snapshots with the San Mateo County Department of Emergency Management. The knowledge we've gleaned and we've taken from each of the snapshots will really be able to help us engage in the county's emergency communications working group that's set to reconvene tomorrow. We'll be able to use kind of the experience and the knowledge and perspective we've pulled from these past few months to bring that into the discussions with the county going forward. So I also did want to reiterate that these snapshots are meant to serve as more foundational documents for the COAD and are kind of a form of a warm-up exercise for the committee members to really get our wheels turning and to start to think more about each of our nonprofits' kind of respective capacity for preparedness, response, and recovery. And so I think when we go through the snapshots, the content might seem a bit overwhelming, but I think it's also helpful to look at the snapshots as really just a starting point for future collaboration and work. We'll also have about 10 minutes after each of the snapshots are presented to kind of have any questions or comments about them. So please hold them to the end or type them in the chat and I can collect them and we can talk about them afterwards. And with that, I think we can start off with the snapshots then. So the first subcommittee presenting will be older adults and access and functional needs. And this is led by our 2 co-chairs, Irma Rodriguez-Midden and Heather Cleary. So I'll pass it over to them.
Thanks, Betty. Welcome everybody. So we are working obviously on older adults and access and functional needs, and we're going to start by just describing what the uh, population that we're focusing on, and then really focusing into a couple of the key gaps and planning areas that we'd like to focus on in the future. Heather, do you want to jump in and talk about the populations that we're serving?
Well, it's definitely a complicated population in that we don't really know where everybody is, and everybody has different unique needs that we want to accommodate. But without the knowledge of where people are and what they need, I think we're finding we need to be able to provide tools to the people in our community, and so they can so they can advocate for themselves in some ways, and so then we can help them. So if there is a disaster, we know who to talk to, where to go, and what some of the needs are that we're going to anticipate.
Yeah, the first thing we found is that, how we define older adults and access and functional needs residents is it's probably the first step. Obviously, older adults are 60 plus or 65 plus, um, but we have older adults living independently into their 90s. So there's a big spectrum just among that population. And then there's obviously, and when we talk about access and functional needs, that could be sensory, that could be physical, that could be that, so there's another, it's very broad, and we want to really make sure that we're not overlooking anything critical if we paint too broadly this population. So some of the key capacity gaps we found was, as Heather said, was just having data on where those populations are at a neighborhood level, or at least a zip code level, because that will help our very small CBOs know or who we can rely on to even contact that population and make sure no one's missed. And I think also making sure that caregivers are included. And so that increases the number of people we've got to have on our lists and have materials for that might be different than materials that we put out for professional service providers. And I think the next key thing, if we want to go to the next slide, Betty, in terms of additional gaps, we saw our, transportation. So transportation and what we need to transport. It might not just be the person, it might be specialized equipment, it may be their service animals. So that's another key area to try to figure out how are we prepared to serve that, to meet that need. Certainly, how do we alert people, and making sure that our alert systems account for not only different languages, but different communication needs. And then, of course, and I think this is probably going to be universal among all our committees, is how do we help the CBOs, with serve in a surge capacity, basically, right? We're probably limited on staffing on a good day. So what can we expect of our CBOs, when disaster hits? So those are just some of the key areas that we've identified so far. And like Betty said, this is the beginning of the support structure. We're pretty confident that over the next year, we'll be able to identify ways we can meet these gaps, at least identify the ways, maybe not the funding, but we'll get there. So it seems like a lot of different areas we need to address, but I'm pretty confident with this group that we can tackle it. Heather, do you have more we should add?
No, Irma, I think that's well presented and you hit everything. The only thing I'm just going to raise up a little more is what Georgia said in the beginning. Communication is the key. And if we can communicate together now about what could happen, we'll be much better positioned to communicate with each other when disaster is happening or right after.
Thank you both. And yeah, I know I think the capacity gaps can be daunting, but I also think it's better to understand what gaps exist in advance of an actual disaster emergency happening. I don't think it's something you want to figure out in the moment. So it's good to have more knowledge than less knowledge, I think. And I think this was a really helpful exercise. Um, so I'll pass it along then to the second committee to present. It'll be Mental Health and Spiritual Care Committee. So I'll pass it over to Laura and Mark to present on these.
Mark, you want to take it away?
I certainly can. Thank you, Laura. So Laura Palmer-Lohan and I are the co-chairs for the Mental Health and Spiritual Health Committee for COAD, and we're going to just kind of talk about what our current gaps and planning needs are to start. We have a limited volunteer surge capacity for anything beyond like an immediate response. We feel like there needs to be refresher trainings in psychological first aid. There's obviously very fragmented communication across agencies across the county. There's a lack of multilingual materials for our diverse communities. And we need stronger coordination for our faith-based responders. This is an aspect of the community that we really need to lean into. Did you want me to do the second slide as well, Laura? I'm going to guess yes. So our next steps are we want to develop a mental and spiritual health annex. We need to conduct a tabletop exercise for earthquake scenario because that's the most likely disaster that we will face. We need to recruit and train new disaster mental health volunteers, create a rapid communication toolkit for the first 72 hours, and deepen our partnerships with local emergency management. So one of the aspects that I'm really glad that the emergency communications meeting is happening tomorrow, because none of this is going to matter if we can't be in contact with each other. And after a major quake, we should expect to potentially not have mobile phones or internet access for up to 2 weeks. So we really need to start figuring out how to better coordinate our efforts. And so I look forward to further discoveries along that arena. Our guiding principles, especially during a disaster, is compassion first. There's going to be a lot of emotions after a disaster. And so we need to be able to engage our compassion and empathy, as well as cultural humility, since there will be a variety of different belief systems. Collaboration across agencies and communities is invaluable. We need to empower the survivors as partners in recovery. And we want to embody resilience by restoring hope and community connection through and after the disaster. How prepared we are before a disaster will determine how comfortable we all are after one. And that is all I've got for you all. And I'm available for your questions or comments.
Thanks, Mark. And yeah, I think the guiding principles are really important for all of us to consider as well from our kind of position as CBOs and nonprofits. I've had this conversation with others, but I think sometimes first responders and emergency management professionals, when they're responding to a direct need and it's a disaster and emergency and life is being threatened, I think sometimes they kind of focus on maintaining and like managing that kind of, they're very focused on life, but I think having guiding principles and having these unique considerations, especially for the populations that we're serving, if we're able to communicate that with them before, whether that's through education or training. I think embedding that into their response will be really helpful for them going forward to kind of making sure that they're interacting with care and compassion towards these populations to continue to build that trust. Sean, I see your hand raised, but I'll just ask to hold it after the last two presentations, and then we'll have some time for questions. Okay, great. So I'll pass it to the next group then, the Children and Childcare Committee, and this will be presented by the co-chairs, Andres Romero and Melissa Poling. So I'll pass it to them.
Hi, everyone. Thanks for being here and just for joining us. We're just excited to continue to work together and just learn more about what's available and also some of the work that we need to do to be ready in case of any disasters. For this group and committee, it's very population driven, right? If you didn't know, children under 18 make around 20% of the San Mateo County's population. So some of the areas that we want to focus on is before a disaster, during a disaster, and then after a disaster. So before a disaster is, uh, working with childcare centers to be essential hubs for preparedness education. So working with families on communication, how to be ready, and also have some engagement around this topic. During a disaster, as you know, children really rely on consistent caregivers, safe spaces, and access to essential needs. Infants and toddlers require constant supervision. So really working with childcare centers just to know how to act or become the hubs during a disaster in our area. And then after a disaster, thinking through everything, one of the things that we really want to make sure we focus on is really including emotional recovery, right? That's such a key important aspect to the work that we're going to do, but also for parents and for kids to really have an understanding of their emotions and what they went through and how to be able to help them through that part. And then some of the key subgroups that, we saw is, again, it just infants and toddlers require constant supervision and stable routines. Children with disabilities or complex medicals or behavioral needs. So thinking through all this different types of population that fit into this children committee, right? So again, thinking about children with low-income households or families facing language barriers or limited access to anything digital or emergency alerts. And then also really thinking through how can we work with the foster youth that already feel marginalized and just to make sure that they feel included and that we also think about them through this process. And then I'll pass it on to Melissa.
Perfect. Yeah, so we really wanted to think about kind of what the first 48 to 72 hours look like and thinking through evacuation and sheltering and what kind of immediate needs young people, especially again, babies, infants would need in that time, those critical care items. And then maintaining a continuity of care and supervision, like Andres mentioned, right? This population needs the constant supervision and how to get the aid that's needed. We all know that schools sustain a lot of young people's nutritional needs, right? They get a lot of their meals provided by school, breakfast and lunch for school age kids. And so those programs, how do we supplement that? Or how does the district kind of maintain that, but then also use food banks, emergency providers, things like that. And then providing that emotional and mental health support for children experiencing the trauma of displacement that's potentially happening. And then also, like Andres mentioned, coordinating that communication with parents and guardians and the various different languages needed. And if they don't have access to technology, how we do that. And I did want to highlight just some things that have come out of our conversation. SMCOE does have emergency preparedness. That's the County Office of Ed. Sorry, use lots of acronyms. Maintains emergency preparedness guidance for schools and licensed child care providers. So that does exist, and that's really great. Head Start and Early Learning has some infrastructure and communication, and school and childcare facilities. Many are prepared to serve as temporary shelters or support hubs during times like this. So I just want to uplift those, and I'll pass it back to Andres.
Yeah. And, just like Melissa mentioned, there are some plans out there, but I think there is as we were working through this together, we've saw there's some capacity gaps, which is there's inconsistency and inclusion on childcare providers and our local emergency operation plans. So how do we include them to make sure their voices are heard, and also what are their needs? There's a limited disaster training and communication infrastructure for family childcare homes, insufficient access to funding for a variety of preparedness needs. There needs to be a clear communication protocol between the schools, childcare centers, and also the county emergency management. And then the last one that we talked about was the lack of shared database or coordinated hubs for childcare closures, reopenings, and resources requesting after an event. So Fort St. Mateo County keeps a shared database regarding childcare closures and reopenings, but it's how do people have access to these resources or know that they need to belong to these resources as well, so we know what's happening around our county. So yeah, that's what we have so far for our group.
Thank you both. Okay, I'll pass it off to the final issue area committee then. This is our food security committee and staffed by Judith Guerrero, Jack Tang, and then Daisy Lee. So I'll pass it over to them to share.
Good afternoon, everyone. We focused on like the children committee on developing immediate priorities for 48 to 72 hours. As food, we are, a resource that is needed very quick and right away. We are very happy that we are part of this collaborative because we are going to depend on a lot of you guys to communicate and to ensure that we are getting food to all of the individuals that you guys serve and the many different ways that it has been mentioned today, right? In the proper language, to the proper areas. I was really glad to hear that Irma's collaborative and Heather's collaborative was thinking not only about the seniors, but also the caretakers, and also thinking about the different areas that are in San Mateo County. For us, we talked about the need for having additional connections to food distributors, and also thinking about what it means for some of the areas in San Mateo County that are isolated. I serve the coast, so I always advocate for how the coast, if the two highways are closed, we would really need air support to receive food. But I know there are other areas in San Mateo County that would find themselves in that situation. And then I think a lot of the times we look to the county to be our source for food, but the importance of also building connections with other food providers that can be activated in case that the county is not able to provide the food sources. I think that most of us, if not all of us, receive food from Second Harvest, and they are a great provider. But it doesn't hurt to have additional support, and also ensuring that we are serving the population that needs meals that are ready, and that the information about food accessibility is also available in the various different languages and culturally appropriate to the entire communities that we serve in San Mateo County. I will say that we are going to need all of you guys to make sure that everyone, in case of a disaster, has access to food or knows where to go for food, or that we as providers know where to go to bring food to someone in need. And I know Jack is here with me. Jack, I don't know if you have anything else to add.
No, thank you, Judith. The only thing that I really wanted to kind of highlight is which you kind of talked about, is the fact that cross committee effort is going to be a big one for us, because there are so many needs that are going to kind of go hand in hand when disaster strikes. For example, if there there's a flood, and parents that are already having to send their kids for daycare are not going to have the time to go pick up food. So if we can collaborate and maybe work together in tandem to have the food available at the child care center, then they only need to make one stop. And that's just one example, right? And the other thing is that we are really trying to leverage the network that we have in our committee to go above and, kind of go beyond our network and maybe leverage off of private sector as well when that happens. So we can't all rely on Second Harvest. I think we really have to kind of go outside of the box. And in Judith's case, when let's say the pathway to the coast is blocked, by a landslide, can we find a quadcopter company to deliver a drone to deliver food out there? Those are the type of initiatives that our committee is working toward to come up with different solutions. And so I'm really looking forward to seeing results, at the end of the course.
Yeah,
And
and
yep,
to
go
add
ahead.
more to what Jack said, we even started thinking about, is there alternative routes that we are not using, right? Is there maybe through someone in our meeting mentioned that some of those hiking routes that we use recreationally can be connectors for community in times of disasters. So just trying to think outside the box to ensure that food as a resource is available, and that we're not stopped by the barrier of a physical obstacle, that we figure out a way and think of all the resources that we are going to need to ensure that food is available to everyone for the immediate need, but also in case it needs to be a longer term need as well.
Air five.
Thank you both. Yeah, I think definitely I have the vantage point of being able to sit in on all the committee meetings, and I think food security have presented some of the most creative options for like securing food and working on food access. I think we were talking about working with like airline carriers or potentially like thinking about drones at some point. So yeah, there's been a lot of great conversations, and I also appreciate, Jack, what you said at the end towards the need for cross-committee collaboration and work. And I think that's something that this exercise is illuminated, and also something that in 2026 we're thinking about kind of thinking about the structure of the committee meetings and potentially having every other month being a committee specific meeting, and then each other month being a like all committee meeting where we're getting all of the co-chairs and all of the committee members together to share their findings and to be able to coordinate in that way. I think that would really help people kind of see the through lines and see the opportunities for connection more frequently than just these quarterly all COAD meetings. But yes, thank you all committees for sharing these snapshots. I'll share each of the snapshots out on the follow-up email after this call. But I think it was a great exercise for everyone involved to kind of just understand, to get the wheels turning with what our emergency preparedness looks like, to begin to think about, okay, what is my nonprofit's capacity? What am I underprepared in? What am I prepared in? And it really identified a lot of opportunities for work and opportunities to kind of to share outwards with our other partners, with county emergency management, and hopefully kind of tailoring and focusing future discussions. So I really appreciate everyone's contribution. I think we have about 15-ish minutes for any kind of community remarks about the disaster readiness snapshots, comments or questions. Feel free to raise your hand or just come off mute, put them in the chat. And you can address it to a committee or just kind of pose an open question, and anyone can feel free to respond as well. I just wanted to save some time for general discussion. Sean, I see your hands up.
Hi, I'm a disability advocate, primarily in Santa Cruz. One of the things that we learned is that at, UPS and Amazon, they're not delivering to official the official sites where people have to go. to relocate temporarily. People with disabilities often have they don't have large amounts of their supplies. Somebody who is a wheelchair user may have may need more medical supplies than someone else. Everybody's on a subscription, so they get sent a couple of weeks at a time. So they need to be reminded that their Go Kit must include as much of that as they can take with them. If possible, if they, like when there's a forest fire, you have some time to pack up your Hoyer lifts too, because no relocation sites, they don't have that sort of equipment there, and people are going to need that. The other thing that I know that peace officers and emergency response, the technology that they don't have is the kind of adaptive technology that allows people who cannot speak, people who are blind, and who use Braille, right? They don't have that. It's not new technology by any means. Harvard grad's first deafblind graduate she's a local. She lives in Palo Alto. To find out, all things disability and adaptive, just find her social media. Her name is spelled Haben. Her last name is Girma. We use that technology every time I sit down and talk to her. It's also how she works with the WHO, the World Health Organization, and she's a practicing litigator. So that stuff works. Another thing we found out is that something to find out ahead of time is where bread distribution warehouses are. They when they pull bread products from the stores that are at or near the Best By date, they get taken back to the same warehouse where they are delivered from. It's ranchers that come and pick that up to feed to their livestock. Their cows and pigs are eating chocodiles and donuts. But I was able to go to one in San Jose to take that all throughout Santa Cruz County. But one of the first stops was where in Boulder Creek, where the community was gathering. So I parked right next to the FEMA truck, and then the day after the roads opened up, I drove up to the 3 firehouses because they had just gotten their power back and their freezers were empty. So I helped stock them. So that's like a sort of, uh, really bad case scenario type of thing, because food banks already have more bread than they need. And the last thing that might be helpful for you is if anyone's not familiar with CERT, CERT, it's Civilian Emergency Response Teams. It's an offshoot of FEMA. We have a lot of different trainings, and what we do is we do real basic stuff out in the field for emergency response teams and individuals. And there's a lot that we don't do because we just follow directions and stay out of everybody's way, but we have a lot of training. So you're not going to have direct access to them because they're set up to work for and take all their cues from local agencies. But you can tell your local agencies that you are interested in working with working with these trained individuals in the case of a natural disaster. That's what we train for. Natural disasters. That's it.
Thank
So,
you,
yeah.
Sean, for sharing. I want to make sure other people have the opportunity to share and ask questions, but thank you so much for sharing those resources, especially with CERT and considerations for, people with disabilities, people with access and functional needs. I think there are so many considerations that people don't normally think of, or they think of when there's an actual disaster emergency. And I think you're right that these are things you need to think about in advance, and resources you need to seek out in advance. And I have information on certs as well, so I'll be able to share that with the group if folks are interested. But thank you. Judith, I see your hand is up.
Yeah, I just wanted to ask Laura if how can we support for the psychological first aid? And if there's anything that we can do to support or to ensure that those trainings are happening before any disasters, to let us know. I know that if something like that was offered, I would love to have the opportunity to bring that to the coast. Thank you.
Yeah, so Judith, NAMI provides a couple of different programs we in Spanish. So we have Ending the Silence for Youth that provides youth the knowledge in terms of how to articulate when they're having difficulties and how to ask for help or how to recognize those signs for others and lean in and provide that support. There's also the Compartiendo Esperanza, which is really an icebreaker conversation to start to destigmatize within the Latinx community, a conversation around mental health. And then we have Family to Family in Spanish as well. And those are for people who are providing care for others who are, living with a mental health condition. There's an organization, and the name escapes me right now, that they do offer the mental health first aid, which is, I think it's like an 8-hour course, as well as a Be Silent, Be Brave program that helps with suicide prevention. And the name will come to me, I'm sure, after I stop talking. And when it does, I'll either shoot you a text or drop it in the chat. So thank you. And we're happy to help and engage. Yep, Kingdom Love, that's exactly it. So that's the organization that does a mental health first aid program.
David, I see your hands up.
Yes, thanks. Yeah, I was very glad to hear that childcare providers are being thought about in this plan, whether it's sites for gathering or whether it's just because they have kids there if things happen during the day or for some at night also. And I just wanted to make sure that people know that 4Cs is here to support the providers, particularly family childcare providers, but we work closely with Heather, with the county office, with Angel at Head Start. So in terms of information dissemination, preparation for when it happens, we can definitely help get that out to providers. And I'd love to help think through or potentially think through some of the ways that childcare providers can also in, ensure get in touch with parents or a way that parents can know that they are all right and a system in place for reuniting. And again, that may be some of the training and support we provide before these things. But 4Cs is here to help in those and other ways as we can.
I've had a thought. This has probably been tackled in the group on childcare, but is there a really strong list? And Heather, you might know this too, from like the COVID times in terms of those childcare centers that were really able to provide kind of that childcare for first responders. So I think that list would be really good to revisit because I know a few of them, they were the ones that were able to stay open. Is that something that you guys have talked about, or David or Heather, do you guys have that list?
I don't have it. I don't know if it was ever created. David, do you know?
No, I don't know that it was created. I think we provided referrals in real time as we were able to. We do have the list from licensing, and it's also supplied to MCCP, the state database, a list of all licensed programs, early childhood programs here in the county. And you're right, though, Georgia. A lot of places did not close at all during COVID. So the kind of natural disaster that we're talking about, in terms of earthquakes and things like that, I mean, I guess it depends on the severity also, and
I
a
think
little
it's
bit
a
different. But
good, I think we've been broadening the definition of disaster here to include everything from pandemics to now with the national crisis and the kind of crisis with our local immigrant community. So we are broadening the definition of a disaster. And, we have many folks that are in our policy and advocacy committee who say we are in a disaster right now. This is an emergency. Similarly, I think there are things we can learn from COVID, right? And that I just remember those childcare providers who were like stepping up to serve first responders. So even if they may not do it for a physical disaster, right, they might be a good starting point. So I think thinking about that network in advance would be interesting.
great, thanks. The old childcare response team doesn't meet formally, but we run from meeting to meeting together. So it's definitely something we can look for.
Great. Are there any other final comments or questions, either about the snapshots, the COAD in general, future work or communications? Great. Seems like we can wrap a bit early then. So yeah, just thank you all for a really productive meeting and a presentation of the snapshots. I'm really excited that we're able to share them with County Emergency Management tomorrow at the working group session and have them kind of inform the communications framework that the county will be putting together with Thrive Support and its nonprofits. And I think eventually that will feed into, as we're kind of talking about resource mapping and nonprofit mapping within the county, another project that we want to do eventually is getting a very comprehensive understanding of the landscape of nonprofits and their respective capacities. I think ideally in sort of a visual map-based format. And so making that as sort of a tool that the COAD's able to use, nonprofits can use, that County Emergency Management can use to really visually see where are nonprofits within the county, what resources, what capacity do they have, and then kind of alongside that communication structure and framework, kind of integrating those two together, I think will be a really important resource that we're in talks about developing with the county as well. And these snapshots will really inform. So as I mentioned earlier in the call, we'll be reconvening the committee meetings in the new year. I'll send out a follow-up email with all of those committee meeting dates in January as well. And feel free to contact me or just add it to your calendar if you'd like to be added to a particular committee meeting. And before we sign off, I know our marketing person, Brenda, would like to get a picture of everyone who feels comfortable just for our Thrive, one of our Thrive newsletters. So if you're comfortable, feel free to come on camera. And I think Brenda will coordinate us for just a quick photo. Thank you.
Yeah, thank you, Betty. Do you mind sharing your screen just so we can see everyone's faces? Okay, great meeting, everyone. And I'm going to take the picture in 3, 2, 1. Let me get everyone in here. Okay, awesome. Thank you all so much.
Great. Thanks, Brenda. Thanks, everyone. Have a great holiday season, and we'll see you later.